So we're recording. I'm sorry about not having the slideshows, being able to see them up on the TV. I think I have that remedied. We will do that today. Miss Sonja Jones is our first presenter. She does not have a slideshow. She's just going to talk. So she does have the microphone. The microphones went dead yesterday, so we're going to try this again today and see how well it goes. So, all right. If you need me, instead of putting it in the chat, if you don't mind sending me a text, because the computer's behind me, as you can see, there's the camera, and I'm looking at the laptop sitting up on a shelf. So I'm going to give the floor to Miss Sonja. We're going to get started today.
All right, thank you. We're going to talk a little bit about different types of infectious diseases and what infectious diseases actually are. There are many infectious diseases that have kind of come back around, had been nearly eradicated, but they've come back around and they're starting to show a big prevalence in all areas of the country. A lot of this is due to decreased vaccination habits, and I think everybody got a little freaked out during COVID and didn't vaccinate, and so that's kind of started a trend that a lot of these diseases have reached increasing numbers and they're becoming more common. One of the ones that we don't think about a lot is Candida auris, which is a yeast. It has the potential to impact many organ systems, including infections of the skin and soft tissues. It also infects ears, lungs, and bloodstreams, and that can have an impact on mortality rates. Candida is a type of yeast which is spread by direct contact. It develops quickly in compromised populations such as nursing home residents, which we deal with a lot. Here in the ER, you deal with a lot in your practice. Patients that have a lot of medical problems, people with frequent hospital stays, or weakened immune systems are also prone to having Candida. When caring for somebody who has a yeasty odor, suspect Candida. This can easily spread to the bloodstream or the lungs of the elderly or chronically ill, especially if the caregiver is not mindful of contact precautions. Candida is seen in elderly people, obese populations, or disabled populations. And it's also very, very common in people that are unable to attend to their own hygiene needs. Candida is one of the most common contaminants found in central line infections. So that was kind of interesting, I thought. Contact precautions should be used when suspecting Candida on a patient. EMS providers should consider wearing gowns when transporting patients that they suspect to have Candida. It keeps the EMS providers from transmitting that on your clothing. The CDC,
is it a skin contact?
Okay, it's a skin-to-skin contact. The CDC recommends contact precautions when dressing, bathing, or showering with people, especially when transferring also, or when providing hygiene or changing grease. Also when providing device care, wound care, physical therapy, or changing linens to people that have Candida. So that it's becoming more and more prevalent. I've read quite a bit about it in the information that comes out of the infection control newsletters, and especially in the nursing home populations, it's running rampant. So be real careful when you're going into the nursing homes about wearing proper precautions when you're taking care of those people.
Is it pretty prevalent here?
It is pretty prevalent here. We see a lot of it. We see a lot of it in obese people especially. They get it in their skin folds a lot. We see a lot of it in elderly people.
I have a question.
Yes.
About protection, rather than us necessarily wearing a gown. What if we just make sure they're well covered by a clean sheet that we bring in with us?
Yes, that would be sufficient.
Just because, I hate to say it, but so many patients in nursing homes or who just can't take care of themselves don't smell right.
Yes.
And if you're like me, you got chronic sinus problems.
Yes.
You can't smell.
Yes.
And if no one tells you, just make sure they're covered.
Make sure they're covered.
Okay.
Transfer them. Yeah, that would probably be a really good way of doing that for EMS to deal with that type of thing. But it does spread when it gets on your clothing. One of the most feared diseases in the U.S. that was virtually eliminated to vaccine was polio. Polio is actually coming back around. In July of 2022, the CDC became aware of a case in New York State from an unvaccinated individual and has since confirmed the presence of polio virus in the area's wastewater. So polio is actually back in the United States. Polio is identified by an acute onset of flaccid paralysis in one or more limbs with decreased or absent tendon reflex in the affected limbs, without any other apparent cause and without sensory or cognitive loss.
May I interrupt this 1 minute? Can we make sure we've got de-icer here and over at Mammoth Springs for the ambulances for this weather that's coming up, just in case the door freezes
Yes,
up?
sir. If you'll just bring it in, the Mammoth crew will be in here in about 5 minutes.
I'll go get some in.
Okay.
Have we got some here? Do y'all have some here too?
I haven't seen
I
it.
haven't looked.
I'll get some for here too then.
All right, thank you.
Tend not to look until I actually need it. And then it's too late.
Yeah, isn't that the way it goes? Polio actually isn't confirmed until the patient continues to have neurologic symptoms for 60 days after the onset of initial symptoms. So it's a little bit hard to track down.
When I said snacks, you really
get
took the
snacks.
holy smoke. Crazy.
Yes. That's now.
And why did you put that right in front of me? Are you trying to indicate something?
Hey man, I know where they're going.
Where's that other metal chair? Is it over there? Or is that white?
There is a chair.
Oh, do you mind letting him sit in that? Thank you. The child side, the modern child size, quality chairs,
That one is home.
the child quality chairs. Sorry, you guys.
No,
Sorry.
that's fine. That's fine. We're good. We're good. We're talking about polio right now.
Got it.
Polio presents asymptomatically in 70% of cases, so it's very difficult to track down. But only 25% of people develop mild symptoms such as fever, sore throat, fatigue, nausea, headache, or stomach pain. However, these symptoms will last 2 to 5 days and they'll resolve. Less than 1% of people who contract the polio virus actually have more serious symptoms such as meningitis, paralysis, or paresthesia. In that case, there's a rapid progression of symptoms with asymmetrical weakness. Proximal weakness will be more pronounced and there will be low muscle tone with absent or diminished deep tendon reflexes. These patients will have fever and muscle pain with a history of recent fever, sore throat, malaise, and nausea. They may have difficulty speaking or swallowing and may develop respiratory distress. This polio is actually seen most often, of course, in unvaccinated individuals.
Is it more of an autoimmune?
It's a
disease?
virus.
A virus.
It's a virus. Polio is a virus. Yeah. Patients who become ill with polio will have a travel history to a third world country. So if you have somebody that's has some kind of unexplained symptoms and they've recently been to a third world country, that virus is something to suspect. It's endemic in Pakistan and Afghanistan. So we do see people that come back from Afghanistan periodically. They may also be lab or healthcare workers who handle specimens that might contain polio virus. There may be people who are in contact with or are caring for a person who could be infected with polio, or someone who's been exposed to polio, or they could be unvaccinated adults whose children are receiving oral polio virus vaccine while living abroad. The testing for polio is done through serology and pharyngeal swabs. It can also be tested in cerebrospinal fluid. Patients with polio should wear masks during transport, and only healthcare workers with polio virus immunity, in other words, vaccinated, should attend a patient with known polio virus. Staff should wear masks in addition to standard precautions, and patients should be placed in positive pressure rooms. It's highly doubtful that you'll see anybody that actually has polio. It's very, very rare, but it has been seen in the United States again. And so it's just something to kind of keep in the back of your mind. Measles, however, is one of the most contagious infectious disease and the most contagious vaccine preventable disease. And measles is on the rise. Measles is on the rise, especially in Arkansas. A lot of unvaccinated kids out there. Approximately 90% of susceptible persons in close contact with measles will develop the disease. So remember when we were a kid and the neighbor kids had measles or chickenpox, one or the other, and your mom would take you over there to make sure that you got it so that you could develop immunity to it. That's what happened when I was a kid, probably not so much when you guys were kids. That's why our parents would expose us to another child who had measles when we were kids. It was so we could get the disease, get over it, and have immunity. Millions of doses of vaccine were postponed or missed during COVID. So there are increasing outbreaks across the United States. Exposure is airborne with measles, and it's defined as spending any time while unprotected in a shared airspace with an infectious measles patient at the same time. People with measles can have a fever as high as 105.0. They will have malaise, cough, runny nose. A lot of times they'll have conjunctivitis. They develop what are called complex spots, and those are kind of bluish white spots on the inside of the mouth. And then after they develop those, they'll usually break out in a familiar measles rash. Healthcare workers should consider measles in patients presenting with febrile rash illness and comparable measles symptoms, especially if that person traveled internationally or was exposed to a person with any febrile rash illness. Healthcare providers are required to report suspected measles cases to their local health department, so that is a reportable disease. Specimen collection includes serum, throat swabs, nasopharyngeal swabs, and actually we can detect measles in urine.
So serum, what kind of serum?
I'm not real sure which tube it is they collect, but get a rainbow of tubes, they can run that. I'm not sure. According to the CDC, we want to adhere to airborne and standard precautions. You want to wear N95 masks when you suspect measles. Patients with measles should remain under airborne precautions for 4 days after the onset of the rash. Caregivers should have evidence of immunity, including vaccination as a child or laboratory evidence of immunity before caring with someone with measles. Patients with measles should wear a face mask during transport. They should be placed in an airborne isolation room at the time of admit. These patients may need supplemental oxygen because of the cough and the barkiness.
So are we talking about the surgical masks or are we talking about the N95?
I would say patients would wear a surgical mask and the healthcare workers would wear an N95.
Okay.
How about putting them in our COVID tents?
I would say that was probably a good idea. You know, the little
That gives them a little
yellow
extra
thing,
room, but
yeah. Healthcare workers who develop measles can expect to lose up to 21 days of work. So it's a big deal, okay? Beginning up to 5 days after exposure to measles is when we start to develop some symptoms and know that you probably got it.
Can you catch it again or like chickenpox?
I think that you just get it once. You haven't ever had measles?
Hard to say, I think it's just once, from what I recall.
Yeah, I believe it's just once. I had measles as a kid. But if not vaccinated, the vaccine is available at Baxter through the employee health or through the health department. It's a 2-dose vaccine.
I do know recently, within the last 2 or 3 months, since, around Thanksgiving maybe. And I don't even know it was Arkansas, but it was in the Arkansas area. I was online and there was a thing about some kid that had it who had ended up dying due to complications, who got it either from a sibling who had been at a daycare or got it while at daycare.
Yeah.
So it's not like, oh, it's measles, not a big deal, it's a bad cold. No,
No, it's a big deal.
it can be,
It
yeah.
can be. Yeah. And if you're a kid that doesn't necessarily break out in a rash, but you've got the measles virus, that's when people tend to run a really, really high fever.
And of course, they were unvaccinated.
Yeah,
which, you know,
and that's becoming more and more common. So, not a big deal.
I was wondering if you can get home till 2 o'clock.
and there were only 20 left.
Oh.
How many did you eat?
You need him on the way.
I'll go at break.
Yeah.
I think bought breakfast for us
Get everybody
yesterday.
loaded up on cake and chocolate.
Well, I seen him, I started doing it because I seen him digging into the chocolate. And yesterday he was cussing everybody, get away from me, so.
Well, good.
Trying to get the microphone in.
Okay. All righty. The next one of the contagious diseases that we're gonna talk about is the avian flu.
Oh,
Bird flu is becoming more and more prevalent, and actually, it has been seen in Missouri, and there has been the first death in the United States from avian flu within the last week. I'm not sure what state that was in, but I was reading it on one of the
I noticed
blurbs that came across my phone on the news. Said
I noticed
somebody
that
had
too.
actually died from that.
Well,
Where?
I don't remember.
I can't remember what
I
state it was
say, I'm
in.
quite sure I'm probably immune to it because somebody brought us some birds years ago that had some kind of
Well,
flu.
it didn't used to
And
migrate to
we ended up
humans.
having to keep
Yeah, I think that was the
killing
thing. I
off
think
and
it didn't
slaughtering
used to
off
migrate
anything
to
that
humans,
showed
but
signs
now
and
it
symptoms of it.
Yeah,
does.
it's,
And so, of course, we had
It's
handled
become
them all
more
the
and more and
time,
more
so.
of a concern, that's for sure. It's, there are cases now in the United States. On September sixth, 2024, the CDC confirmed a case of avian flu, which is also known as H5, in Missouri. Identified through the state's seasonal flu surveillance system, this patient was hospitalized. The patient had underlying conditions, but was treated with antiviral medications and has since recovered. This case had no known animal exposure, so that's kind of, where did they get it? Kind of funny. It was the 14th case reported in the US in 2024, and the first one without exposure to sick or infected animals.
Well,
When we get to the point where it's human to human,
yeah.
passing the virus along, that's kind of scary.
bird man came along, just pooped on something and then they touched it. So
Well,
who
it's,
knows?
yeah, it's hard to tell. Outbreaks of H5 have been reported in commercial and backyard poultry flocks in 2024 and in wild birds in the state. The patient that tested positive for bird flu also tested positive for flu A. Bird flu has been found in dairy cows.
Well, from the farms like that, if you notice, there's always a big flocks of starlings and cowbirds that come and fly from one farm to another. So even if you tested there, like our birds that we had, initially it was pretty bad, but anything that we just kept killing off, and which we pressure canned them at the time, we were just like, well, they got something, we don't know what it is, so we're just gonna pressure can them, which that pretty much kills anything anyway. So that's what we did to anything that had any kind of symptoms and stuff. And eventually, after 4 or 5 years, it got to where there was nothing. That they developed immunities to whatever it was. And initially, it was bad. But after that, they got to where it just continued to lessen.
Yeah. Bird flu has been found present in dairy cows. Mammals can be infected with the H5N when they eat infected birds, poultry, or other animals, or if they are exposed to environments contaminated with viruses. So like I say, if you've got birds in the area that contaminated the area. Human to human transmission has not been observed, however, it's been suspected. Occupations that require work with poultry or dairy cows and those who interact with wild birds are at risk. Like all strains, this will continue to mutate and evolve, and that's what's scary. As it evolves into new hosts, the virus can mutate in a way that increases disease severity or allows human to human transmission. Such a change could result in a pandemic. Currently, the CDC believes the risk is low, and getting a seasonal vaccine will not protect against the bird flu. However, there are vaccines being developed. So they're working on it, in other words.
Right now, we're in the middle of duck season, or turkey season coming
Yes,
up.
yes, exactly. Pertussis is another one of the things that is on the rise. People are seeing an increase in whooping cough. And that actually has become a real problem in Arkansas and a lot of states in the South. Often misdiagnosed, pertussis begins with mild upper respiratory tract symptoms similar to the common cold and progresses to a cough that has paroxysms and inspiratory whoop, which is gasping. Repeated coughs on the same breath, and that can be followed by vomiting because you've coughed so hard. Fever is absent or minimal. Symptoms wane gradually, but it takes sometimes weeks or months to wane. The duration of classic pertussis is anywhere from 6 to 10 weeks. So if you've got somebody that's had a cough that has just hung on and hung on and hung on, might be something to consider about. It's most severe when it occurs during the first 6 months of life, particularly in preterm or unimmunized infants.
And this is still bird flu?
Pertussis.
Pertussis.
Okay, we switched, okay.
Yes, we're talking about pertussis. Diseases in infants younger than 6 months can be atypical with a short stage of the cold symptoms, followed by gagging, gasping, bradycardia, or apnea as prominent early manifestations. Complications can include pneumonia, pulmonary hypertension, and severe coughing spells with associated hemorrhage in the conjunctiva. They can have hernias from the coughing or hypoxia. They can
So
also have apnea and acute respiratory distress.
just to make sure I didn't fade away there for a couple of seconds, is the bradycardia due to the respiratory?
I think so.
Okay, just
yeah.
making sure I was
They
not,
hold their breath.
I
or
didn't
they're
miss something there.
coughing. Yes, bradycardia can be associated with that.
I was like, I didn't know that that would affect cardiac, but it's, okay. That's,
Yeah.
okay, just making sure, because I kind of faded there for a moment.
Death can easily occur in infants with pertussis. So immunizations with tetanus and diphtheria toxoids with acellular pertussis vaccine are recommended during each pregnancy and with an infant's receipt of vaccines. And it also recommends that after you become an adult that you get vaccinated every 5 years for pertussis.
With each pregnancy.
With each pregnancy, and I didn't know that.
Wow.
Yeah.
The recommendation, because most of the time they're like, oh, don't get exposed to all this different stuff.
Yeah, yeah. So that's the only vaccine that I've heard of that they recommend for you during pregnancy that they do. Humans are the only hosts of pertussis. Transmission occurs by close contact with infected individuals via large respiratory droplets that are generated by coughing or sneezing. Cases can occur year-round, so it's not necessarily a seasonal thing. Neither infection nor immunization provides lifelong immunity. Like I said, vaccines need to be repeated every 5 years. Pertussis is highly contagious. Infected people are most infectious during the catharthal stage, which means when they start to develop cold-like symptoms. Catharthal stage.
That is a new word. I like it.
CHEHARTHAL.
Yeah, you'll work that in when you get home.
Catharthal stage, cold symptoms.
Word of the day.
Yes. That can last up to 3 weeks. And they can also be infectious until 5 days after the start of antimicrobial treatments. The incubation period on pertussis is 7 to 10 days with a range of 15 to 21 days. So like you can have it for a while before you ever know that you have it. A nasal swab is the method of testing for pertussis, and a 5-day course of azithromycin is the appropriate first-line treatment for pertussis and for post-exposure prophylaxis. Bactrim DS can also be used for patients who cannot tolerate the azithromycin. However, infants younger than 6 months are frequently hospitalized with pertussis. Characteristics that would suggest the need for hospitalization include young age, respiratory distress, inability to feed, cyanosis with apnea, and they can also have seizures. These patients should be managed in a facility where those complications can be recognized and managed appropriately. So pertussis is very much on the rise, especially in Arkansas, something to really be considerate of.
So is it, I'm assuming, is it seen more in lower income?
Yes, lower income, unvaccinated populations where there are a lot of people living in the same house. You know, and they're seeing it in older people quite a
Thank
bit too, so not just in the babies, but in the adults. So,
I think you guys missed it. You brought the ice or brought part of it for y'all to take that. Take the other part over those.
there you go.
Merry Little Christmas.
All right. Let's talk a little bit about varicella or chickenpox. Chickenpox is also on the rise.
Are you still in infectious or?
Infectious, yes.
Okay.
We're talking about infectious diseases. Varicella is very contagious. The virus can spread by breathing in the viral particles that come from the blisters of an infected person. It can also be spread by direct contact with the fluid of skin lesions. A person with chickenpox can spread the disease from 1 to 2 days before they get the rash until all their chickenpox blisters have formed scabs. So, initial symptoms include sudden onsets of fever, headache, and feeling tired. So that kind of sums it up for all of us.
It's hard to miss this.
So anybody in
Anybody in
EMS
here,
possibly has
yes.
chickenpox.
An itchy, blister-like rash, which usually starts on the face, chest, or back, follows 1 to 2 days later.
Or shingle?
Yes. Then the rash spreads to the rest of the body, and new blisters continue to appear for about 3 or 4 days. Generally, within a week or so, the blisters dry out and the scabs form and fall off. The chickenpox virus, however, stays in the body even after recovery. Later in life, the virus can reactivate and cause shingles. So you don't get chickenpox twice, but you can get shingles later in life. Although shingles and chickenpox are caused by the same virus, they are not the same illness. Chickenpox is usually a milder illness and affects children. Shingles results from a reactivation of the virus long after the chickenpox illness has disappeared. So if you have shingles, you can spread the varicella virus to people who haven't had chickenpox before, or they've never received the vaccine.
And
These people will develop chickenpox, not shingles.
The kids that I've seen when we had chickenpox were little, my cousins didn't get chickenpox until they were like 14, 15. It was awful. It was worse.
The
Because they
older,
were-
the older
they
people get
get,
really sick a lot of
the
times with
worse.
chickenpox. Yeah.
it is with the chickenpox.
Mhm. It takes anywhere from 10 to 21 days after exposure to shingles for someone to develop chickenpox. So you want to be real careful about an older person that has shingles if you're bringing kids around that person. There are 2 vaccine options for chickenpox: 2 doses of the varicella vaccine or a combination vaccine, which is the measles, mumps, rubella, and varicella. The CDC recommends that healthy adults 50 years and over get a vaccine for shingles. And that's a 2-dose vaccine. The best way to prevent chickenpox and shingles is to get vaccinated. Avoid direct contact with people infected with chickenpox or shingles. Wear gowns, gloves, and masks. Cover the rash when transporting. So once again, you want to make sure that you've got them covered with a dressing or sheet. Avoid touching the rash. Patients should be advised to avoid scratching the rash, which is something they tend to want to do. And of course, wash your hands often. So did you guys want to take a little break before we go to immunologic diseases?
I assume you're gonna get to pneumonia at some point.
I haven't, but
We don't do that.
We're gonna take a break.
we can talk about
Well,
pneumonia.
The only